I'll talk to you about a very rare condition called cholangiocarcinoma. See, jaundice is a very common symptom where the eyes become yellow, the urine becomes yellow, people develop itching, and majority of the jaundice is due to a medical condition, either due to viral hepatitis A, B, C and so on. And most of the jaundice are self-limiting, and within a week or so they'll, without any treatment, they may become all right. But some people, especially people who are 60 and above, and they develop very severe jaundice where the eyes are very thick yellow, and then they also have itching, they are scratching all over the body, and these are the patients who are should be very closely followed. And these patients have a condition called obstructive jaundice. Obstructive jaundice is due to the blockage of bile flow from the liver and bile duct into the intestine. Something will be blocking there. If the block is in the bile duct, the condition is called cholangiocarcinoma. The bile duct, part of the bile duct system is outside the liver and part of it is inside the liver, and patients can develop a tumor in the bile duct either inside the liver or outside the liver, and this condition is called cholangiocarcinoma, which is a very serious condition because it's not easy to diagnose this condition, and they require very special tests like a CT scan on MRI, MRCP and so on, which will show that there is a block in the intestine. Because by just looking at the scan itself, one can make out that this is a possible cholangiocarcinoma, and many times there is no need for a biopsy to confirm. The problem with this cholangiocarcinoma is it's not easily treatable. Definitely it's not treatable medically. No medicines can cure that condition. Even surgery is not that easy. Surgery is the difficulty in surgery will depend upon which area it's located. Sometimes we might have to just remove the head of the gland pancreas, sometimes we have to remove the entire bile duct system, and sometimes we have to cut half the liver intake. And in some other conditions, if the tumor is only inside the liver and not gone outside it, we have to do what is called liver transplantation, where we will remove the liver, put another new liver. So, effectively this cholangiocarcinoma is a rare condition, and if anybody who's got very high jaundice with itching, one should suspect it to be a cholangiocarcinoma, and we have to do appropriate tests in the form of CT, MRI to diagnose it. And of course, there are very few specialists who are experts in treating this condition. If this is not treated in time, it will spread to the rest of the liver and in outside the liver to lungs and so on, then treatment is not easy. A very handful of patients whom surgery is not possible, there is a method of making passage of the bile from the liver into the intestine by putting plastic or sometimes even metal tubes called metal stents. In these patients, we can reduce the jaundice and itching and make the life more comfortable, but we may not be able to prolong the life of these patients. There are very few drugs are available which somehow improve the life a little bit, but again the drugs will not cure these patients. This is all about cholangiocarcinoma. Thank you.